One of the most important perks of working in transitional care is the ability to really establish a long-standing relationship with your patients and families.
We get to see the progression of the patient. We get to see them come in a wheelchair and hopefully leave walking out the door with a walker by themselves.
We provide everything from the basic wound care to advanced wound care. You get to watch these patients as they proceed through this therapy, and you watch them heal and you watch them progress.
I've had some patients for years, just depending on what's going on with them. So you really get to see them come home and see how your nursing actions help them get better and go back into the community.
Since I'm kind of the sole person that's in the home a majority of the time, a lot of times they rely on you to give them kind of the feedback that they're looking for.
Good interpersonal skills, I think, is a good attribute for a nurse.
Definitely have to have a passion and compassion for what you do. I think you have to be okay with death and dying.
I would say you need to be independent, flexible, dependable, feel like quick on your feet.
You have to be able to sit next to your patient who needs the support and provide that support.
Some misconceptions that you hear about transitional care or rehab is that it is a long-term care facility where maybe you think you have a patient load that's unmanageable. Here at rehab, we have the same ratio as the hospital. We're usually 5 to 7 patients per nurse.
There's a lot of learning opportunities here in skilled nursing, and those you can bring anywhere you go.
Nursing is very generalized as a female career. As a male, you can come in, and the often different personality types that you get with male versus females, it can benefit your patients.
That you don't need a lot of skill set to be a hospice or a home health nurse, but I disagree. I think you need a good foundation.
What I love most about working in the rehab hospital is the people I work with.
Definitely the connection. So there's many stories that I have that I could tell, and it's also kind of the dialogue. I'm really passionate about having the dialogue about end-of-life care with people.
I would say scheduling is the biggest perk. Make your own schedule, so if you need to stop somewhere in the middle of your day, you can go do that.
What I would say to a nurse who is considering a career in transitional care, I would encourage them to reach out to the different areas and have the opportunity to experience them before making that decision. But I would say if you're interested in developing that relationship and seeing a patient throughout that healing and wellness process, I would encourage you to take that opportunity to shadow in those areas.